About COVID-19, Dr. Lauren Stryker is back with us. She's a clinical professor at Northwestern University Medical School and a practicing physician. And you can submit your questions right to her on her website, drstryker.com. Good morning.
Good morning, Lauren and Larry.
Hi.
So let's start off with the first question. Should I let my regular babysitter come for a few hours a day? I could use the break. I know a lot of parents feel like, man, I could really get a little bit of break here.
Of course you could use the break, but the reality is you don't know what your regular babysitter is doing the rest of the week, particularly if she's only with you a few hours a day. It's a very different scenario than someone who has a full-time babysitter that you know that's doing social distancing. So my advice is the greater good, unless you really can't take care of your own child. This is a time to pay your babysitter, because I can guarantee you she needs the wages, but let her stay home if at all possible. Because even though we just talked about a small child that has COVID, for the most part, the kids are not getting it and the kids are not getting sick, but you know that your child is going to be very close with the babysitter, and then your child's going to be close with you. So this is all just part of social distancing, which is so important.
All right, next question. A friend said I should take off my wedding ring. Is that true, and why?
It's actually not a bad idea. We know that, of course, hand washing is the #1 thing that men and women need to do in order to get that virus off the hands with any particular contact they might have. And it's very difficult to get underneath the ring. And depending on the kind of ring you have, a lot of stones, there can be actually virus harboring in the ring. And this is why surgeons don't wear jewelry. I mean, I spent my entire surgical life not wearing jewelry. And in fact, I have taken off my rings about a week ago so that I can be sure that I'm getting the best hand washing possible.
I saw a lot of people wearing latex gloves, and this is part of the story. A lot of people are wearing latex gloves. Is that a good idea?
If you're a doctor, if you're a nurse, if you're a healthcare professional, it is a great idea. Otherwise, it's not a good idea. I mean, think about this. If you have someone, say, in the grocery store who's wearing rubber gloves, latex gloves, and they're wearing them all day long and touching a million different things, if they touch you with those gloves, that's like a million people touching you. It is much, much better to wash the hands, to use the hand gel on a regular basis than to wear those regular gloves. And to that same point, one of the big concerns we have is with regular people using masks, using gloves. Our healthcare professionals are not going to have enough. This is a huge issue throughout the United States right now. The supplies are running low, and the frontline medical professionals who absolutely need those masks, not only to protect themselves, but to protect patients, can't get them. And I just want to point out real quick while we're on the topic, I've been home, of course, and I'm very busy with different things, but a little project I've started is I am starting to make masks. You can see this is one of my cloth masks that I made. I do have a sewing machine. There's a number of tutorials to do this with the idea that if in fact supplies run low, this is something that if you do have a sewing machine, if you do have some scraps of cotton, this is something that people can do because we all want to help. So it's not there yet, but a little bit later today on drstryker.com, I am going to put a tutorial on how to make your own surgical mask, which sure, you can use it for yourself, but I think it's also terrific if you are able to start making masks for healthcare professionals who may need them.
All right, next question. Can I breastfeed my baby? What if I have the virus and don't know it?
Like a lot of other things, there's a lot we don't know when it comes to COVID-19. And as of today, this can change any time, but as of today, the virus has not been detected in breast milk. Now, obviously, there have not been a lot of studies, but the CDC is recommending that if you are breastfeeding your baby, even if you have COVID or if you think you might have COVID, the greater good is still to breastfeed. That may change, but right now, no COVID in breast milk.
And is it safe to get groceries delivered to my home?
This comes up a lot. It's not just groceries, of course. It's anything that you might want to get delivered to your home. And the #1 risk to getting groceries delivered to your home is the person delivering them. So what you'd like to do, if at all possible, is prepay, including a tip, so that that person can leave the groceries outside your door. Once you get those groceries, bring them inside, wash your hands, of course, and then as you're putting your groceries away, use your alcohol wipes to wipe down the cans, the boxes. Certainly with soap and water, you can wash fruits and vegetables in an abundance of caution. And then when you're finished, wash your hands again.
All right, real quick, one more question. We have been trying to get pregnant. Should we stop trying?
There's been no COVID that has been detected crossing the placenta in term babies. So far, this could change. But early pregnancy is a little bit different, and we do not know. Some viruses can cause problems early in pregnancy. We expect to be getting information from places where it's been around for a few months as to what happens when people get pregnant. My attitude is, it wouldn't be such a bad idea to wait a month or two if you're trying, but if you're already pregnant, don't get nervous about this, because as far as we know, it is okay, but I think it's not a bad idea to hold off until we get a little bit more information if you can.
All right, Dr. Stryker, thanks so much.
Thank you.
And for more, go to drstryker.com.